procedure, your body is at your most vulnerable. Cardiac rehabilitation is essential to help you get back on your feet. There is no one better to vouch for the importance of cardiac rehabilitation than Chris Russell.
As many of you know, I had a heart attack in 2004 when I fell into some very cold water at the age of 51 up in the Hawkesbury, and was really only, I think, able to resume what I see as a very fulsome schedule of now retirement, including this big round Australia trip, enjoying my grandchildren and all the other things you can do, thanks to a combination of the way the heart attack was handled in the acute sense, but also in particular how it was handled in the rehab sense. Now, you know, we all hear all sorts of stories about the public health system. My experience was amazing. The rehab program back in 2004, and I'm sure it's even more advanced now, was quite astonishing and certainly beyond our expectations. And I'm very delighted today to be able to chat with Anne and Maura. Anne in particular was involved in the program in 2004 when I was first had my heart attack, and I must say it hasn't changed at all since. Looks exactly the same, and I'm sure with now all this extra experience, she's going to be a massive aid to us understanding this. Certainly there's no doubt that the evidence would say that after a coronary event, you know, readmissions or death, you know, is certainly a high probability, but it's been reduced by over 50% by these rehab programs. So that's how important they are.
What is cardiac rehabilitation? Maura Farrell has worked in the acute cardiology ward at the Royal North Shore in Sydney for the last 18 years as a nurse and later as a nursing unit manager. Since 2007, she's worked as a heart rehab and heart failure services manager, managing Royal North Shore, Ryde, French's Forest and the Hornsby area, which is most of North Sydney, as you can see. When it comes to cardiac rehabilitation, there are not many as experienced as Maura, so I'll let her explain the premise of heart rehabilitation.
Cardiac rehab, it's a lot of things, but I'll start by saying it's a structured program. Typically, it would start with if the patient is, say, from one of our local health district hospitals by a nurse and or sometimes a exercise physiologist attending the patient at the bedside after they've had an acute event. And, you know, the nurse will talk to the patient and get their understanding of what's happened, talk them through in plain and simple English, if you like, there's a lot of jargon used in hospitals. So it really starts there at the bedside with the patient, you know, talking about their discharge home, planning for their discharge home, introducing cardiac rehab services, which really encompasses education. There's a series of education on a broad range of topics around lifestyle and exercise. So before COVID, which seems a long time ago, we had we recommended people would come into the hospital, into the inpatient gym twice a week for an hour's exercise. Prior to that, they would have an assessment again with a nurse and a cardiac nurse and an exercise physiologist to sit down with the patient and to go through their goals and their understanding of care. And once they've had the assessment, so there's a few measures we take there at the pre-assessment, and sometimes patients say, for whatever reason, we might just opt for the to tune into the education sessions or do both. It's quite flexible. And now, of course, we offer an online, due to the COVID environment, we're offering an online education and delivery of exercise. So, you know, it's really supporting the patient once they get home from that sometimes really short stay in hospital when a lot of things have happened to them. We educate them on, you know, their risk factors, diet, lifestyle, the importance of exercise. And whilst they were coming in for exercise, I mean, that face-to-face connection is really advantageous for a number of reasons. They would also meet other people, and as I'm sure you did, Chris, in a similar situation, and gain confidence to exercise and hear other people's stories, that they're not alone. And I think a big part of it is just some people don't want to do anything after they've had, a heart event. Other people, we deal with a broad range of people as well. It could be a young athletic person, and sometimes they're hard to rein in because they want to do too much too soon, all the way up to a frail elderly person that needs to, maintain their function of everyday life. So we have a broad range of people. So really it is education and exercise and supporting people and referral to other services.
One of the few people as experienced in heart rehabilitation is Anne Kirkness, who is a clinical nurse consultant in cardiac rehabilitation at Royal North Shore Hospital, who describes the increasing need for cardiac rehabilitation in the modern age.
I think it's just evolved with time, because now, sort of 20, 30 years ago, people spent a lot longer in hospital.
Yes.
And so now, it's like a drive-through. You pick up your stent and you keep going. So it's, I think there's probably a much greater need for that outpatient follow-up where people get questions answered, because I think there is that sense that they kind of barely realise what's happened. You come in, you get your stent, you feel good, and away you go. So, the program has obviously evolved. It's a multidisciplinary program, and it involves, nurses, dietitians, various people. There's a lot more focus now, as Maura mentioned, on sort of your mental and emotional health. We recognise that it's a significant contributor to your recovery, and so I think it as Maura says, it evolves with the passage of time, and of course more recently telehealth and that, all those sorts of things. So I think, and it's got bigger. I think there's a lot more on offer now. It's far more flexible in terms of what people can take out of the program.
Cardiac rehabilitation starts as soon as you go into hospital for heart surgery or treatment, or after you've had a heart attack. Who is heart rehabilitation for? Cardiac rehabilitation is available to anyone who has had a heart attack, a coronary angioplasty, heart surgery, some people who have angina or heart fever, and some people who have an ICD implanted. However, cardiac rehabilitation generally aims to be more inclusive to those who feel like they need it, and you may be eligible even if you don't meet this criteria.
We'd love to welcome more people, and we do. Look, predominantly it is people that have had a heart event, because we've got limited, unfortunately, resources. But that said, we have had the odd cancer patient, an endocrine patient, different patients that that have a risk of having a heart attack or a heart event or heart disease. So we would like to welcome everyone, and generally, we've got a pretty broad church of people that come. That if we had more resources, we certainly could. There's very good evidence for all diagnosis to exercise. It's one of the best prescriptions you can have, really. So we try not to exclude, but we have to create capacity for patients coming through, and certainly you can have heart risk. You can have risk factors for heart disease and come to cardiac rehab.
What are some immediate steps that you can take to reduce your risk of another heart event post-heart attack? The 4 M's used in preventative heart attacks are also useful post-heart attack, with the 4 M's being movement, putting emphasis on exercise, meals. Healthy eating with low cholesterol foods puts less strain on your health. Measurement of health. Make sure to measure your progress. Finally, optimistic mental attitude. Taking care of your mental health is vital in your road to recovery. More information on this can be found in our Stress in Your Heart video.
Look, I think the 4 M's actually incorporate a lot of things, and I think the one that is also sort of keeps us all honest is the measurements, and I think everybody's different. But I think sometimes, if you jump on the scales and you measure your weight, say weekly, or you measure the steps that you do from the step, whether it's your phone or a pedometer, all of those things help to keep us in check. It's called self-monitoring and helping people to self-manage. Things like meals, there's a lot of information out there, and I would encourage people to check out the Australian guidelines, because obviously they're updated regularly. There's lots of information, and it is always being updated, because obviously it's a bit of a moving feast, as more information becomes available. Really important to move. I can't stress enough the importance of physical activity. And I often say to people, if we could bottle the benefits of physical activity, we'd have have a winning combination. The problem is physical activity requires self-motivation, and we have to do it, and that's where it's kind of not always easy to maintain that motivation and sort of keep that balance in your life, essentially. I think the only thing that I would probably add, and it's probably to do with the mental approach, is there's something that I call the disease of busyness. And basically that's this modern world where we have so much technology. Our kids are busy, everybody's busy, and with that it becomes difficult to actually fit in exercise. I think life balance is quite a hard thing to sustain, making sure that you have time for relaxation, that you have time for exercise, eating healthily, getting enough sleep, those sorts of things. And yet I think they play a really important role in terms of your mental health and your ability to kind of transform your lifestyle.
You should also be invited to join a cardiac rehabilitation program soon after you leave hospital. A member of the cardiac rehabilitation team will normally visit you in the ward to provide you with information about your condition, the treatment you've had, and your recovery. This will help you get back into your usual activities as soon as possible. The peer support that cardiac rehabilitation provides through a structured exercise program is invaluable. By grouping you with people who have undergone similar experiences with heart disease, recovery no longer seems insurmountable.
I think that support is really, I think it's kind of something that's undervalued to some extent. And what we found during COVID is, people have that telehealth, but they don't have that face-to-face support from either the health professionals or their peers, and that is huge. I mean, I haven't had a heart attack. I think listening to somebody who has, who's been through it and who's actually coming out the other side, and I think we always want to focus on what you can do, and that there is life, and often a really good life, because something like this actually motivates you to improve your lifestyle and to prioritize your health.
The peer support is particularly important among men. Men are more likely to suffer from heart disease at a younger age, and as such, younger men are prone to feeling more isolated with a heart condition, and having the support from people sharing a similar story is invaluable.
There's incidental learning that goes on too in cardiac rehab. So it's formal, we have formal education, but there's lots of incidental, they'll come up to you with a question while they're exercising or, during the exercise. And, that's where a lot of that incidental learning happens. So, I suppose that you could argue that open heart, that more invasive procedure is more of a reminder that your recovery takes a bit longer and you may benefit.
Unfortunately, only about 30% of patients who have suffered from a heart event participate in the rehab program. Often it's the patients that need cardiac rehabilitation the most that don't join. Some hospital stays for heart events are very short, and the awareness for rehabilitation programs is quite low because of this. You can find out where your nearest heart cardiac rehabilitation program is by visiting the Australian Cardiovascular Health and Rehabilitation Association website for their program directory. The link is on the screen.